All right. Hello, everyone. I hope you guys are having a great Wednesday evening. I know we have some or had some snow falling here not too long ago, which is pretty nice, but I hope you guys are having a great day, having a great week. And thanks for joining me on the education series webinar today. Today, we'll be covering glute training for runners. Mixed feelings on this topic, to be honest with you. Super important. Sometimes put on a pedestal, I think, higher than other things, which it shouldn't be, and very misunderstood to a degree. So hopefully we can clear up a lot of that today. As you know, with most of these education series webinars through the Ignite Your Run group, can try to do my best to review the research as I create these rather than just creating it based on my opinion and what I see. So as we get into this, you'll see there's just so much information out there on hip, glutes, glutes with knee pain, glutes with lower back pain, glute tendinopathy, just function of the glutes and the hip as you run. So this is a lot of the information that I combed through for this. And there's definitely a lot more out there, but I just didn't want to get too deep in the weeds with some of this stuff. So if you are interested in kind of nerding out on some of these things, you're welcome to screenshot this page and look into some of the research that I pulled this information from today. But again, we'll definitely explain a lot of that as well to be a little bit more simple here. So focus of the presentation today. I always laugh when I see this little guy. This picture just cracks me up. But we're gonna start talking about why do we need to address the glutes, basic anatomy and physiology. We want to understand what they are, what do they do, and then how neglecting these other areas of the body can impact the glutes. And this is very important. A lot of times we look at things in isolation. And I get a lot of clients that either come from a doctor or come from PT and say, oh, you have weak glutes, or your glutes aren't doing this. We can't just look at them in an isolated fashion. When you look at the whole kinetic chain and how things are working together, since everything is very interconnected. And then we'll talk about simple exercises to improve neuromuscular control or activation, strength, stabilization, and power. If you have any questions as we go through here, you're welcome to drop that in the chat box right now, or as we get to the end. But let's dig into the content here. So why do we need to address the glutes? The glutes are these three muscles at the posterior lateral aspect of the hip. Running, right? We're talking about running specifically. Running is a single leg plyometric-like activity. So these muscles are at a very important junction between the trunk, the hip, and the lower extremity. So we need them to absorb force. We need them to stabilize. We need them to propel the body and move us from A to B, right? They have a very important role as it relates to running specifically. The glute medius muscle, which we'll talk about the anatomy a little bit more in a second, there's a lot of force being put on that glute medius muscle specifically from a stabilization standpoint. As you're landing and striking on one leg, that glute medius muscle is firing before you actually strike the ground. And as you hit the ground, because it wants to try to stabilize the pelvis, the spine, the femur, all of these different areas there. So there's a lot of force being put down on the glute specifically. What we need to understand, not everything is a glute issue. And not everything requires clamshells, right? Everyone's done these clamshells exercises in the past. One of the most famous that you'll see from a PT standpoint. We often victimize the glutes. The glutes are the problem. The glutes are weak. The glutes are inhibited. My glutes aren't firing. There's a lot more to it than that. I think this is something that we blame too much to a degree, and we'll kind of talk about that in a second with some of these other areas that impact glute function. And then clamshells, that's something we need to progress, right? If you're doing that clamshell exercise, that's good from a PT standpoint early on in your rehab process as you're rehabbing an injury, but we need to quickly get past that because there's a lot better exercise out there that are going to carry over to the demands of running. Now, from an anatomy standpoint, glutes are comprised of three different muscles. On the left image here, we have our glute minimus, which is more lateral on the hip. You can see come on that posterior lateral side of the pelvis, going down to the greater trochanter. On the right image, but left side hip, left side pelvis, we have the glute medius, a little bigger, this fan-shaped muscle that comes down and attaches on the greater trochanter. And then we have this glute maximus muscle, which is this bigger muscle, attaches at the iliac crest and pelvis, or along the SI joint and sacrum, comes all the way down, attached to the femur, the IT band there off to the side. So three different muscles. A lot of times we think about this as one. However, there are three different muscles, and they have different roles depending on the position you're in and the demand you're placing upon them. So if we break these down into a more simplistic standpoint, Glute medius and minimus, right? Those are two lateral muscles, deeper down, right? Minimus is the deepest, medius is a little bit more superficial, and glute max is on the outer portion there. In an open kinetic chain, so what that means is when your foot is not in contact with the ground, that glute medius and minimus are going to lift that leg up in the air. So if you think about hip abduction is what this is, right? We're going to lift that leg away from the midline up into the air. That's using that glute medius and glute minimus. From a closed kinetic chain standpoint, so look at this right side image, when that foot is actually in contact with the ground, the job of that glute medius and minimus is to stabilize that pelvis to prevent adduction, which is the leg coming underneath the body, and stabilize that pelvis to keep that pelvis nice and level straight across, right? So its function is actually very different depending on the position you're in. And we think from a running standpoint, this right side image here, right, being in that stance phase of running where that foot is on the ground, you have to stabilize the pelvis and the femur. That's really the where a lot of those forces are being placed on the glute medius and minimus to stabilize the pelvis, to keep us in a nice efficient position so we're not losing energy and losing stabilization as we go through. So very important muscle, a group of muscles here from a running standpoint. Glute maximus now is in the open chain, right? We're talking about this bigger butt muscle, if you want to look at it that way. Glute maximus muscle is going to extend the hip. So as we get into that stance phase running, we strike the ground, we start to push off and propel the body forward. The glutes, the hamstrings, the calf, some of those intrinsic foot muscles, all of those things work together to push the floor away as you extend it and push off the ground. So it's a main extensor at the hip. In a closed kinetic chain, so more so in that earlier stance phase of running when that foot's on the ground, when it strikes the ground, and then when that foot's underneath the body, that glute, because if you look at the anatomy, we can see, look how this glute is this direction, right? The angle of its fibers, right? It's coming here off the sacrum and ilium of the pelvis. It's coming down at an angle, wrapping around outside of the femur and attaching down here towards the IT band on the lateral side of the hip. So its main job is to prevent us from going into these positions, all the positions you see in this image here on the right side of the screen, preventing the knees from rotating inwards, the knees from collapsing inwards, the feet from coming inwards, right? It's a cascade of events that tends to happen if we're not stabilizing throughout the hip, things that you can see all the way down to the foot and ankle and lower leg. So both of these are very important from we're talking about the glute maximus standpoint, because we want to push off forcefully, right? That's the glute there as it extends the hip. We also want to use those muscles and those fibers to help stabilize, right, the femur on the pelvis, to keep good alignment, good position of the legs. This is why in a lot of exercises, right, when you squat, when you lunge, again, we're always trying to reinforce proper alignment to a degree, right, to make sure that those knees aren't always collapsing inward, which is called a valgus collapse. That's the prime job of the glute maximus. It has that rotational capability there to make sure we're staying in a nice aligned position. Other areas that impact the glutes, a lot of different things. And this is why I think, and I commonly see people that come in, oh, I was told my glute is weak, my glute isn't firing. So first off, what glute, right? We have glutes that are abductors and stabilize the pelvis. We have glute max, which is extensors that prevent internal rotation, adduction, right? We need to understand exactly what of these three muscles we're talking about, rather than just throwing out, oh, it's the glutes, because that could mean different things. It's almost saying like my shoulder, hey, my shoulder is weak. Was your shoulder weak going forward, to the side, backwards? Like which direction is your shoulder weak? It can move in multiple ways. Same thing with the hip and the glutes. There are some ranges of motion that really matter to the hip and the glutes specifically. And these are the key ones for running. And I always talk about this when most webinars and in most videos and things that I put out there. We want to be able to extend the toe, right? If your foot is flat on the ground, can I extend the toe? So that the top of the toe there is coming towards the shin? Can I dorsiflex the ankle, as you can see in the second image, right? The knee going past the toes. And then can I extend the hip? So we don't want to just look at this from, hey, my glutes strong or my glutes firing, all of that. We want to understand, are these other areas, the toe, the ankle, and the hip, do we have the flexibility and the range of motion to get into hip extension? This one right here in the center, this is hip extension, right? That glute is firing to push the body away, to propel the body forward. If we're too tight in the hip right? We have limited range of motion, hip flexor, quad. If we have limited motion in the ankle, right? If this foot was actually on the ground before it completely came off, the ankle and the big toe, if we were limited in any of those ranges of motion, there's no need for a glute, right? We don't have the range of motion to get into hip extension to actually push off and propel the body forward. Therefore, you're probably going to feel weakness. You're going to probably feel like you don't feel your glutes as you do certain things. Not saying you need to as you run every single time. I think that's over exaggerated too, to a degree. But we need to make sure we have the flexibility. You can see on the left side of the screen here, this is what's called the Thomas test. This is looking at hip flexor flexibility. So for a negative test or a normal test, that someone that has good flexibility of the hip flexor and quad, the knee would drop below the axis of the hip. So the horizontal line here, the knee drops below. If that hip flexor and quad are tight, the rectus femoris muscle in the quad, you can see instead of this leg relaxing down, that leg is being held up in that position. So we have shortness or tightness in those muscles. This person, right, if we tell this person to bridge, do a Romanian deadlift, there's a good chance they're going to have trouble doing it just because they don't have the flexibility of the front of the hip to actually get in and use their hips properly to strengthen and activate that glute. So we can't just look at the glute in isolation. We need to look at other areas to see, is there something else that's causing that dysfunction? Then as we look down, the foot and the lower leg, I told you earlier, right, a second ago, the glute maximus, right, in medius to a degree, helps to prevent the hip from going into internal rotation, adduction, if you're going into that consistent knock-knee position. But then we look at it from the bottom up. Are you going into that position because, is it your foot? Is it your ankles? Are we not stabilizing between the floor and the distal part of the lower extremity? Because this could cause the knee to come in as well, could cause the hips to rotate internally. So is it from the top down or is it from the bottom up that you're seeing this dysfunction? And then at the core, right? How are these core muscles stabilizing the pelvis? All of these muscles attach at the pelvis, which is a pretty strong junction there, right? We have our two innominates on either side. We have our sacrum in the middle. Our femurs come off that. Are we not stabilizing the core and the pelvis properly, which is causing some issues there at the glutes? And obviously looking at other muscles, they're going to do similar things. So specifically as you push off here, or we're pushing off with the calf, we're pushing off using the hamstring, we're pushing off using the glute. Is it actually a glute issue, or is there weakness in the hamstring, weakness in the calf, issues at the foot, right? The kinetic chain is so interconnected that we can't say it's always one thing. We need to really assess and evaluate all of these different areas. Andrea, yep. So this is a good one for you, I think, looking at that position, because it's very relevant. Now, if we look at some exercise, I want to spend a little more time tonight going through exercises rather than the principles, because I think seeing some of these exercises to understand the function of the glutes is very important, because the glute's going to, like we showed earlier, stabilize the pelvis. It's going to work on alignment of the legs and work on pushing the body, pushing the floor away or the ground away as you try to propel yourself and move forward. So there's a lot of research out there that looks at the EMG of the glutes, right? EMG is the electric myography. So trying to tell us what exercises are creating or requiring the greatest impulse, the most contractility of this muscle group, right? Sometimes we use that as a way to understand how are we going to really target or contract that muscle to its greatest degree. These are three exercises specifically. Front plank with hip extension, whether you're in a high plank from the hands or a low plank position, but this position right here, because you're not only using the glute maximus specifically to elevate and lift the hip, as you're in that plank position and you go to a single leg, the glute has to fire to stabilize the pelvis, stabilize the femur, right? So we're not just using it on the lifting leg, we're also using it on the stabilization leg as well. So that's one exercise there. Fire hydrants. This right here is actually an isometric hold. So traditional fire hydrants, lift that leg up, come back down. A lot of times when it comes to just trying to get people to connect and feel this muscles better, I like to put them in a position, actually let them hold that for a period of time, because it gives them more than just 1 to 2 seconds to appreciate and connect with that muscle group. So here, leg is going to come out to the side. So you see, trying to find a neutral spine first, leg comes out to the side, back stays nice and flat. And then I'm just trying to engage through that lateral side of the hip, right? This posterior aspect of the glute medius specifically, because it's abduction here and a little bit of rotation. And then next up, this is a variation of sideline hip abduction, trying to get people to move so posteriorly, since that posterior aspect of the glute medius is going to help with stabilization and control, not to let the knees collapse into that internally rotated position. So abduction, like we looked at originally, is letting that leg come out to the ceiling, but you can see here more of a diagonal motion. So these three exercises have been shown through the research to be in variations of, right? There's a lot of different variations of each of these, but have been shown to have the highest EMG activity for the glutes. So these are very good ones to kind of keep in your back pocket. Obviously, we're as from an activation standpoint, we're very low level here, right? We think about the demands of running anywhere from 2 to 6 times your body weight coming down on a single leg. Do I want you to do these to a degree? Yes, right? They're good at a certain point, very good from a rehabilitation standpoint. But as we start to progress our program, work on strength training, work on absorbing force better and plyometrics, that's the direction I want you guys to go in, because this will only carry over so much, right? It's good to activate and feel those muscles, but in the end, there's so much demand as you run. We need to make sure we don't stop at this point. And that's what I see from a lot of people. Kind of go through PT or see a doctor, do a handful of exercise, and then assume they're ready to run. These are just a small percentage of your body weight, right? We're just lifting the leg. We're not landing with 2 to 6 times our entire body weight on that leg. So this is a good first step, but we need to continue to progress after that. Now, as we get into the strengthening area here, you might be able to see these bars at the bottom. I'm going to remove a couple things from my screen. Hopefully you can see better. So now from a strengthening standpoint, we're trying to actually build up strength of this muscle group. So usually with this, we keep repetitions on the lower side, right? Most people we're looking anywhere, repetitions range can vary, but usually for most, I try to keep them under about 8 repetitions in a good strengthening range, but we try to go with a heavier resistance and lower repetitions to really challenge that muscle group. The reason I wanted to start with hip thrust is because we're so used to traditional hip bridges. I think hip bridges are great. Most of my clients do them at a certain point in their program. I think if we're actually going to build good strength as opposed to endurance with a body weight movement, we need to add some type of barbell or external resistance like this. We need to really target that muscle group to a greater degree, right? So that's a hip thrust right there. Just simply shoulder blades across the bench, barbell across the front of the hips, and then we're driving and lifting into that hip lift or hip bridge position to engage glutes, hamstrings, and posterior chain. Next up, more upright here, Romanian deadlift, which a lot of people are familiar with. Romanian deadlift is a more hip dominant deadlift variation. So small bend of the knees, hinging at the hips. And as you come forward, drive the hips forward to stand. So that glute muscle is controlling the descent of the body as it comes down. And then the hips are driving forward to drive back up into extension. Very good exercise to work on developing glute strength. Very good if we're working on adding more strength through the hamstrings, posterior chain. People with lower back issues that have trouble moving at the hips, that always move through their lower back. This is a great exercise that needs to be taught properly, but a fantastic exercise to really develop strength at the glutes, and more specifically glute maximus, which are both hip thrust and Romanian deadlift. These are more hip maximus focused exercises. These next two are now we're looking more so at the gluteus medius. So down here, we have just standing band resisted hip abduction. Research on this one in sideline hip abduction, there was a lot of EMG activity, right? The glute medius, there's a lot of signals, a lot of stuff going on there, that glute medius muscle, just because that leg's a pretty long lever. So if we place the band around the knees, that's a little bit easier. If we place the band around the ankles, that exercise gets a whole lot harder. But we're trying to keep the body up nice and tall. We're not trying to rock side to side or allow that pelvis to really overly tip. We're just trying to abduct that leg away to isolate and strengthen the glute medius and glute minimus muscle. Then where I'm trying to get most people, right? Instead of band exercise, that's the same thing. I think we talked back about clamshells, right? Let's start with the band and let's get back to being able to control our body weight in a more challenging way. Single leg side plank, whether we're lifting and lowering the leg or lifting and holding for a period of time. Our end goal here is to be able to hold this position, single leg side plank for 20 seconds per side. So that is telling us that single leg hip abductor, right? Glute medius and glute minimus, lateral core, your obliques, your QL, all of those muscles on one side are able to hold up your entire body weight, this really puts you in a good position for success if we can progress to that at the right time. So these are 4 examples here of glute strengthening exercises. Top 2, glute maximus, bottom 2 are going to be glute medius and glute minimus. Understanding that it's not just all glutes, right? We might get some carry over here to get different muscles, different parts of the glute, but primarily glute max, here glute medius, right? So we need to understand how we're trying to actually strengthen that muscle and what our end goal is, rather than just strengthening the glutes in a very blanket way. Now, from a stabilization standpoint, like I said before, glute maximus, preventing those knees from coming in, glute medius, preventing the pelvis from dropping. So all of these muscles are super involved to work on stabilization of the pelvis and stabilization of the femur. So if we can keep better alignment and position, right, nice level pelvis, nice aligned leg, that's how we can really move in a nice efficient manner. The more we lose and fall out of these positions, the more it costs us more energy to move, especially as we run. More muscles have to work twice as hard to try to stabilize us and keep us in the right position. But if we can train ourselves to use these muscles the right way, we become more efficient at these tasks like running. One of my favorite ones right here, single leg stance with hip abduction. This is a very straight leg position, nice tall position, bands above the knees. Pelvis is level. I'm going to abduct the leg. Reason I'm lifting this leg out to the side is because this band is tugging at the knee. So like I said before, we want to prevent that knee from collapsing inward. This is providing a little bit of a stimulus to challenge us, but we're up, our pelvis is level, our leg is aligned. We're really using that glute medius and minimus a whole lot to stabilize the pelvis, to keep the body in a nice aligned position. You'll see if you have trouble stabilizing, either the pelvis wants to drop or the body is going to shift, right? We're going to find a way to compensate, to shift over that leg to feel more stable if we're not using those muscles properly. Then here, lateral toe taps. Now we're in just a slightly knee bent position. So with the knee bent and unlocked, it's harder for us to control that internal external rotation. So this knee, you can see, look at the little micro movements here. See this leg starting to kind of wobble around a little bit. I'm trying to do a good job of preventing that. But with the knee bent and the pull of that, this really wants to pull that knee inwards, that knee collapses in. So now glute medius is stabilizing the pelvis. Glute maximus is trying to prevent that internal rotation of the femur as I'm trying to do my best to stabilize. These exercises aren't what you would call really hard, but they're really valuable from a stabilization standpoint. Most people tell me after a few months of doing, hey, those easy, can we do something else? I'm like, no, let's keep going, right? Do more reps, go slower, like really burn those muscles up, because this is how you stabilize properly as you run, as you land with your body weight. These are really the foundational things to do that. Now at the bottom here, we have single leg squat and single leg deadlift. EMG activity rated these as top tier exercises in that EMG article, showing that we're using all of these glute muscles to the highest degree as we perform both of these. So we're trying to focus on level pelvis, aligned knee, and aligned lower entire leg, and controlling as I come down. The glute muscle is going to control as I come down, and it's going to engage and shorten to pull me back up, while we're trying to control the position of the pelvis and the leg, right? There's a lot going on with this exercise. Single leg deadlift, same thing, right? More hip dominant focus, but work to move the body as I slowly control it down and then engage to come up, but also stabilizing the pelvis, stabilizing the leg. So these are really the big two when it comes to getting those glute muscles to work their hardest. Obviously, I don't throw people into these immediately. It takes some time to progress to some of these variations, but these I would say are the big two that you want to get to from a glute standpoint in terms of strengthening and stabilizing that area. I didn't want to leave this out. I didn't say this in the registration of it or the just overview from a plyometrics standpoint, but I think if we're talking about running, we're not doing a good job when we talk about glute training or strengthening. A lot of people think that's enough just to strengthen, right? We want to make sure we understand the loads and the demands on the kinetic chain while running. 2 to 6 times your body weight is coming down as you strike the ground. Therefore, at certain times of your running strength training program, we don't want to do it when you're high mileage, usually off season, lower mileage times. We want to probably jump and land to a degree to expose these tissues to more stress. So first up, this is sagittal plane plyometrics. So I'm jumping for distance. I'm using the glutes and the hips to push off, right? It's almost 2 feet at the same time, pushing and exploding the body forward, as opposed to a single leg of running. So I'm getting that glute maximus to a degree from a power standpoint to really explode and jump for distance. Next one, anytime we start to move side to side, that's when we start to engage the glute medius and glute minimus more, right? Those hip abductors. So this is what's called frontal plane plyometrics. Double leg line hops is a very simple way on 2 legs to start stressing these muscles of the lateral hip, right? Your glute medius. And then as we increase demand on the lateral hip, we then go to medial to lateral jumps. So needing to stabilize, control, keep that pelvis level, land and absorb force. We can progress this then to skater jumps, which is a bigger distance, a little bit more explosive, a little faster from side to side. But these are a very good starting point to start to load these areas from a plyometric standpoint. And I think that's definitely something that people need to really consider more of with their strength conditioning program. Again, like I said, not high mileage times, maybe do this in the off season when running mileage is low, introduce that stress and that force then, because it's less risky, and then start to back down, get away from it as you get closer to a goal race. Now, take home message here. We need to understand the glutes don't work in isolation and the body is an integrated unit, right? So we can't just say everything is a glute issue. There's usually more than one thing going on there. Looking at the toe, looking at the ankle, looking at the hip flexor flexibility, looking at stability of the foot and the ankle, core, how are we stabilizing up there? There's a lot of different things we want to take into consideration. And then when we strengthen and target the glute strength and work on neuromuscular activation, work on power and plyometrics, we want to do this in multiple planes of motion. Even though running is a very sagittal plane sport, you saw especially the glute maximus tries to prevent those knees from collapsing in, which has a very rotational demand on it. So even though we're only moving forward at all times, we're not usually, except trail running, if we're jumping over tree branches or roots or rocks or what have you, but we want to make sure we're challenging the body in multiple planes of motion. This will really help us develop good integrity of the glutes and good integrity of the hip joint as a whole. And then please progress beyond the clamshell. Use some of these suggestions, slowly progress that, make things hard over time. It's not bad to use that exercise, but realize it probably has very, very limited carryover outside of maybe a post-surgical standpoint or an early rehab standpoint. So make sure you progress past that and build the necessary strength at the hip. Most people that I see that come from PT, that's one of their big exercises. And it's usually my job to say, okay, how do we move on past that? How do we take the next step? We're still stressing those muscles, but we're doing it with a somewhat harder variation that's going to really prepare them for the demands of running. So if you guys, and what I want to do a better job of here with the with these education series webinars is just provide you guys an opportunity to kind of ask questions, get things answered more specifically for you. So what I did was, and let me get out of the screen here a little bit. I have a Zoom link that's going to come across to you guys right now. This year, I think we need to do a better job of making sure not just watching things and getting information and then that's it. Watching things, understanding how it applies to your situation and taking action moving forward. I continue to see the same people asking the same questions, and I wonder, why don't these people ask for help? Like, this stuff, if you identify the root cause of some of these things and you get to work, we don't need to continue doing the same thing over and over again or continue to bump into the wall and struggle and have issues. So this consultation is completely complimentary, not a sales pitch in disguise. Don't want to sell you on anything. If I can help you and we need to do an evaluation, I'm happy to do that. But I want to understand how this relates to your situation, what your goals are, what your injury history looks like, and how can we just improve clarity around this topic or other areas so you can do the right thing to see more success moving forward. So that's kind of my additional value add for you guys. But if you have any questions at all, feel free to drop that in the chat box right now. We're going to start to wrap up here as Jeopardy comes on in the next minute or so. So if you have any questions, feel free to drop it in the chat. I will be sending the replay of this tomorrow at 11 a.m. if you want to watch it again for whatever reason. Jessica, thank you. Side plank king. Yeah, well, you gave me a good run for my money there on the side planks and the single leg ones, but I'm still practicing behind the scenes. So, but I appreciate you guys joining me today. Awesome crowd, Andrea, Beth, and Diana, Jessica. I know I had a lot of people signed up for this one that couldn't make it, so I'm going to get the recording out tomorrow. with that. But if you have any questions for me, let's find a time to chat, talk over some of this stuff. I know for several of you on today, very relevant topic. Beth Ann, what is the thrust with the hips and the huge weights? That's called the hip thrust. Not super creative there, right, on the name, but let's see if I can play that one for you. That's right here on the top left. For you, that would be probably a progression. So we could do that with dumbbells now, since you don't have access to a barbell or a heavy barbell. Usually we want to be, you can use some kind of bench. You could use a chair or a couch just to set up the shoulders across and do, but this would be a good thing. So sometimes for people, either go to hip thrust and add some resistance, or further progress the hip bridges to single leg type hip bridges. This in the end, you can load this up a lot more, and it should be pretty isolated towards the glutes and the hamstrings. It's a very good exercise and it really builds in glute maximus strength. So something we can consider as we chat more. So you said that back might freak out. Surprisingly, a lot of this with that exercise, actually, a lot of the stress stays in the hips if you do it well. It's not often. I actually see more people have lower back issues with hip bridges than I do with the hip thrust, surprisingly. I think it's somehow how the weight is positioned at that place allows you to push and really engage through the hips and the glutes more. It's surprising, but I think if you start with the lightweight, you start with the barbell, you put a dumbbell across the hips, biggest thing is just slowly progressing over time. That's really the key with that one. All right, guys. So thank you. We're going to wrap up here. I hope you guys have a great Wednesday evening. Feel free to reach out anytime with questions. I hope to connect with some of you on that complimentary Zoom call. We'll run through some assessments and really kind of dig into your history and what you need moving forward. But as always, I enjoy these short, sweet, and to the point. Want to get you guys out of here on your Wednesday evening. So thank you again. Have a good night. And I look forward to chatting with you soon. Thanks, guys.